Hi, my name is Vaishnavi Rachakonda, and I created a presentation on the expression of hormone receptors in cervical cancer. Cervical cancer remains a significant global health issue, with approximately 660,000 new cases and 350,000 deaths reported in 2022 alone. This form of cancer, also known as cervical carcinoma, is characterized by the abnormal growth of cells in the cervical tissue over time. Cervical cancer's developments involved a variety of factors, including hormonal influences and viral infections. Two key hormones, estrogen and progesterone, play crucial roles in this process. Estrogen, produced by the ovaries and adrenal glands, is responsible for the development of feminine sex traits and reproductive functions. Progesterone, synthesized from cholesterol in the adrenal glands and reproductive organs, is essential for the reproductive system and influences uterine function. The diagram to the right displays a uterus and a cervix. The image on the top portion of the diagram is split in two parts. The left side of the uterus is a view of the external aspect of the uterus, and the right is the internal portion. The diagram on the lower half is an image of a healthy cervix with no growth of cancerous cells. In the 1960s, cervical cancer screening became widely implemented in U.S. hospitals. German virologist Harald Zerhausen discovered the human papillomavirus, or HPV, significantly advancing the understanding and treatment of cervical cancer, for which he won the Nobel Prize in 2008. Additionally, the pap smear, initially conducted in 1928 and proven effective later in 1941, involved scraping and testing cervical cells for early detection of cancer. Despite not being involved with the discovery of cervical cancer itself, Dr. Hausen contributed to treatment by developing HPV treatments, as HPV is one of the leading causes of cervical cancer. HPV, or the human papillomavirus, is categorized into three main types: mucosal or anogenital, which is primarily transmitted through sexual contact, affecting reproductive organs; cutaneous HPV, which causes skin warts, often treated with cryotherapy. The diagram on the right displays four variants of HPV. HPV-8 and HPV-11 are often forms associated with the genital warts or cutaneous warts all over the body. Typically, these are benign and do not cause cancer. In addition, on the right side, the diagram displays HPV variants 16 and 18, which are associated with cancer specifically, often caused by sexual conduct. The third category is epidermodysplasia verruciformis, or EV, which leads to a decline in the immune system's ability to combat HPV and is associated with malignant skin cancers. Currently, there are no entirely effective treatment plans for EV. The diagram on the left represents a genome of HPV variant 16, one of the two more deadly forms of HPV, as it can lead to cancer. Cervical cancer detection is challenging due to the asymptomatic nature of the disease in its early stages. Common symptoms, which may be dismissed as minor issues, include intermenstrual bleeding, persistent back pain or tenderness, vaginal leakage of urine or feces, lower body pain, and persistent vaginal discharge or leukorrhea. Estrogen in its various forms, estriol, estradiol, and estrone, plays a role in reproductive development and the regulation of menstrual cycles. Although estrogen does not directly cause cervical cancer, it influences the progression of HPV infection. Progesterone, produced mainly by the placenta during pregnancy and the ovaries after ovulation, is crucial for maintaining the uterine lining and regulating the menstrual cycle. While progesterone impacts cervical cells similarly to estrogen, the direct role in cervical cancer is less pronounced. Estrogen receptors, alpha and beta, and progesterone receptors are critical in understanding the hormonal impact on cervical cancer. Estrogen receptors alpha can promote tumor growth by influencing gene expression related to the cell cycle, while estrogen receptor beta can be believed to act as a tumor suppressor. Progesterone receptors also affect cervical cancer development, with elevated progesterone receptor expression linked to improved survival rates. Progesterone receptors might interact with the hormonal pathways affecting tumor aggressiveness and treatment response. The diagram on the left represents the structural areas of two different types of estrogen receptors, namely beta and alpha. It examines the percentage of similarity between estrogen receptor alpha and beta across these domains and displays the many areas of function within these receptors. This domain plays a role in the receptor's transcriptional activation activity, or AF1. It is displayed in blue and indicates that there is a 15% similarity between estrogen receptor beta and alpha in this area. Indicated in green is the receptor's DNA binding domain, or DBD. It is in charge of controlling gene expression and binding to specific sequences of DNA. In this region, estrogen receptor beta and alpha are 96% identical, suggesting that there is a considerable amount of preservation between the two receptors. The hinge region, that provides the receptor flexibility, is indicated in pink. In this domain, estrogen receptor beta and alpha are 30% similar. The ligand binding domain, or LBD, is shown in orange. It is in charge of binding to ligands, such as estrogen, to activate receptors. In this region, estrogen receptor beta and alpha are 60% identical, indicating modest conservation. This domain, which is represented in purple, is engaged in the transcriptional and activation function, or AF2, and has a more varied role. In this domain, beta and alpha are 18% similar. On the right, there's a figure representing two stages of the menstrual cycle, the follicular phase as well as the luteal phase. During hormonal cycles, changes occur that both promote and repress cervical cancer. In women, progesterone and estrogen rise in turn during sexual cycles. The pro-tumorigenic effect of estrogen receptor alpha outweighs progesterone receptors' anti-cancer effectiveness in a high estrogen situation. It should be highlighted that while progesterone receptor expression is high in this situation, progesterone receptor activity is low. Even if PR levels are declining to a high progesterone state, tumor suppressive activity for progesterone receptors is prominent. Treatment for cervical cancer is determined by the patient's unique circumstances and the disease's stage. One of the many options is conization. Conization is the surgical removal of precancerous or early cancerous cells from a cone-shaped portion of the cervix. High-grade precancerous lesions or early-stage cervical carcinoma are the usual indications for this surgery. It is a minimally invasive procedure designed to remove unwanted tissue without damaging the uterus or affecting fertility. It has the potential to stop malignancies in their early stages from progressing to more advanced ones. The uterus and cervix are surgically removed during the hysterectomy. The condition may also require the removal of neighboring tissues, including the fallopian tubes and ovaries, depending on the severity of the cancer. When conization is insufficient or cervical cancer has progressed to more severe stages, this surgery is typically conducted. Additionally, it can be used to treat precancerous problems that don't improve with less intrusive methods. The only option for treating localized cervical cancer is hysterectomy, which is sometimes successful, especially if the disease hasn't progressed outside of the cervix. In order to eradicate cancer cells, external beam radiation therapy entails sending high-energy radiation towards the tumor from outside the body. It is used to treat localized tumors, and for best outcomes, it is frequently paired with other treatments, such as chemotherapy. This approach can help decrease tumors or slow the evolution of the disease, and it is useful for treating tumors that aren't surgically treatable. A radioactive source is positioned inside or close to the tumor during brachytherapy, also known as internal radiation therapy. This is typically done through the vagina. It targets the tumor with a high radiation dosage while having little effect on the surrounding healthy tissues. For a more thorough approach, brachytherapy is sometimes combined with external beam radiation therapy, which is especially useful for localized cancers. Drugs are used in chemotherapy to either kill or inhibit the growth of cancer cells. It can be injected intravenously or given orally. It is used as a palliative measure to relieve symptoms or for more advanced stages of cervical cancer, frequently in conjunction with radiation therapy. Chemotherapy can reduce tumor size, control symptoms, and increase chances of survival, but There may be uncontrollable adverse effects. Medroxyprogesterone acetate, or MPA, is a synthetic progesterone drug that is utilized in hormone-based cancer therapies. It may be taken into consideration in cervical cancer instances when hormone-driven components are present, as it can be utilized to treat hormone-sensitive tumors. MPA is not a standalone treatment for cervical cancer, but in some circumstances it can be used in conjunction with other therapies. Thank you for listening to my presentation on hormone receptors and their expression in cervical cancer.